Hello everyone, I am Dr. Karthik, Medical Superintendent and Physician at Sri Lakshmi Multi-Speciality Hospital. Today I'll be telling about one of the most common and most frequently encountered condition, that is thyroid dysfunctions. So most of you would have experienced or would have been on treatment for this thyroid dysfunction. So what exactly is this thyroid dysfunction? What are the types of thyroid abnormalities? I'll be discussing about this. So coming to the thyroid abnormalities, before going into that, I shall briefly tell you about what exactly are these thyroid abnormalities or how do they happen. So in our brain, so there is a gland called as hypothalamus and pituitary. The pituitary secretes a hormone called as thyroid stimulating hormone. This thyroid stimulating hormone stimulates our thyroid gland. So our thyroid gland is situated in front of our neck. It produces the hormones called as thyroid hormones, that is T3 and T4. The TSH, which is produced by our pituitary gland, acts on the thyroid gland. Hence, the T3, T4, the thyroid hormones are produced. So, the T3, T4 are the thyroid hormones. TSH is a thyroid stimulating hormone, which stimulates the thyroid gland to produce thyroid hormones. So, what can happen in this thyroid abnormalities? So, thyroid abnormalities is of two types. One is hypothyroidism, one is hyperthyroidism. The thyroid gland, which acts normally or which produces the normal thyroid hormones, maintains the equilibrium. Whenever this equilibrium is disturbed, like whether the thyroid production is increased or the thyroid production is reduced, it causes thyroid abnormalities. So first let me tell about hypothyroidism. So as the name suggests, hypothyroidism is nothing but reduced production of the thyroid hormones. As I was telling, T3 and T4 are the thyroid hormones which are produced by the thyroid gland, which are in turn stimulated by the thyroid stimulating hormone. So what happens in this hypothyroidism? Basically, the thyroid gland which produces the thyroid hormone is deficiently producing the thyroid hormones. What are the reasons for this? The most common reason is autoimmune etiology, meaning there are some few cells which damage our thyroid gland, which results in the decreased production of the thyroid hormones. So the most common cause of hypothyroidism is autoimmune, which we can precisely sometimes also call it as genetical factor, which most of us would have noticed. Either some family members are suffering from a thyroid dysfunction, whom the daughter or the son also has a similar abnormality. So the most common cause of hypothyroidism is autoimmune diseases, followed by iodine deficiency. Right now, this iodine deficiency is not so much because most of our salts are iodized salts and we don't frequently or much encounter this iodine deficiency states. There are multiple other causes for hypothyroidism, which include certain medications which we use in our clinical practice and sometimes cause hypothyroidism. Sometimes because of some thyroid abnormalities, the thyroid gland is operated. So the thyroid, as a result, post-operative thyroidectomy, what we call it as, which results in entire removal of the thyroid gland, which can also cause this hypothyroidism. So as I told, there are multiple causes, but the most common causes are autoimmune and iodine deficiency. So this is in brief about what is the mechanism of hypothyroidism. Coming to the clinical features. So what are the classical or the cardinal clinical features of hypothyroidism? The most common which we frequently encounter is extreme weakness or fatigability, meaning a person who has been doing his regular activity suddenly feels that there is no energy in him. He feels very lethargic, not able to perform his routine activities. This is one of the cardinal symptoms. Other classical symptoms of a person who is having hypothyroidism is unexplained weight gain. So any person comes to me with extreme weakness, unexplained weight gain of 2 to 4 kgs in few months. So that clinches me towards the point of hypothyroidism. These are associated clinical features of hypothyroidism. But if you ask me, the cardinal features would be excessive fatigability, weight gain, constipation, hair fall, cold intolerance, and in females there are menstrual abnormalities. So these are in again brief about the clinical features. So any person who is experiencing these symptoms with a family background of hypothyroidism or without a family background who is experiencing these features immediately has to report to a physician or whom will investigate clinically. So there are also again some clinical evidence. Apart from symptoms, clinically also we pick up few signs called as the heart rate. I mean the pulse rate will be on a lower side As you all know, the normal pulse rate is anywhere between 60 to 100. Usually in hypothyroidism, there is bradycardia, meaning the pulse rate will be on a lower side. And clinically, we can demonstrate few signs which elicits a possibility towards hypothyroidism. So based upon the signs and symptoms, we can come to a clinical conclusion that the patient might be having hypothyroidism. So once there is a clinical evidence, how do we proceed? It's very simple. We do a thyroid function test, which includes the thyroid hormone testing as well as TSH. So T3, T4 and TSH. So this entire thing is called as a thyroid profile. So we do a thyroid profile. In that we see abnormality. Meaning, as I explained previously, the basic dysfunction in hypothyroidism is reduced production of the hormones. So in clinical results, what we find, the T3, T4 hormone level will be low. What happens when the hormone level is low? The pituitary feels that the hormone production is low and it stimulates the thyroid stimulating hormone. Meaning there will be increased activity of thyroid stimulating hormone. So clinically what we get based upon the clinical features and laboratory evidence. Laboratory evidence, what will happen is T3, T4 will be on lower side, TSH will be elevated. So this is a classical laboratory finding. So we correlate clinically as well as laboratory. So based upon this, we advocate medications. So medications are also quite simple. So it is daily once medication which has to be taken on a empty stomach. The dosage will be calculated according to the thyroid levels and the body weight of the person. So the hypothyroidism is a commonly encountered condition and it is most commonly seen in females. Clinical features, again to emphasize, will be extreme fatigue, weight gain, constipation, hair fall, swelling of the legs, facial puffiness, and clinical signs like low heart rate. And laboratory evidence like T3, T4 hormones will be on the lower side, TSH will be elevated. Treatment is very simple, once a day medication on empty stomach. Dosage depends upon the clinical features and laboratory. So this is in brief about hypothyroidism. So as I told, it's more commonly encountered, but definitely there is nothing to be worried about it. It requires proper diagnosis and adequate treatment to be kept under control. Thank you.